Hello everyone, in today's video we will show you the top 10 powerful countries in terms of best healthcare system to fight coronavirus.
Number 10. South Korea. As of April 14, 2020, 10,564 cases have been reported with 222 deaths and 10th highest recoveries of 7,534. South Korea has about 12.27 hospital beds per 1,000 people and 9,795 ventilators. South Korea confirmed the first case of COVID-19 on the 20th of January 2020, a 35-year-old Chinese woman. During the first 4 weeks, South Korea controlled the potential spread of COVID-19 by using high-tech resources like tracking the use of credit cards and checking CCTV footage of confirmed patients. The government has provided 136.7 billion won for local governments as support. Number 9. Canada. As of April 14, 2020, 25,680 cases have been reported with 780 deaths and 9th highest recoveries of 7,756. Canada has about 2.52 hospital beds per 1,000 people. Canada confirmed the first case of COVID-19 on January 27, after a man returned to Toronto from travel in China, including Wuhan. On March 18, the federal government announced an $82 billion response package that included measures ranging from wage subsidies and income supports to a temporary boost to the Child Benefit Program. Canada Emergency Response Benefit is providing a taxable benefit of $2,000 per month, for up to 4 months for eligible Canadian who are unemployed due to COVID-19. Number 8. Switzerland. As of April 14, 2020, 25,688 cases have been reported with 1,138 deaths and 8th highest recoveries of 13,700. Switzerland has about 4.53 hospital beds per 1,000 people. Switzerland confirmed the first case of COVID-19 on the 25th of February 2020, a 70-year-old man in the Italian-speaking canton of Ticino, who had previously visited Milan. Swiss government has prohibited all events or meeting over 5 people. The government announced a 42 billion rescue package for the economy, which includes money to replace lost wages for employed and self-employed people, short-term loans to businesses, delay for payments to the government, and support for cultural and sport organizations. Number 7. France. As of April 14, 2020, 136,779 cases have been reported with 14,967 deaths and 7th highest recoveries of 27,718. France has about 5.98 hospital beds per 1,000 people and 30,000 ventilators. France confirmed the first case of COVID-19 in a 48-year-old French citizen from China on the 24th of January 2020 in Bordeaux, the first case in Europe. France spends more on health than most of its developed world peers, offers world-beating access to doctors at less cost, and encourages all its citizens, through universal government-funded coverage, to keep track of their conditions. Number 6. Italy. As of April 14, 2020, 156,516 cases have been reported with 20,465 deaths and 6th highest recoveries of 34,435. Italy has about 3.18 hospital beds per 1,000 people and 5,000 ventilators. Italy confirmed the first 2 cases of COVID-19 on January 31 in Rome, in a Chinese couple, originally from Wuhan, who had arrived in Italy on the 23rd of January. Italy provides universal health care to the whole population, with the 20 regions exercising control and the central government providing regulatory assistance. Hospitals are erecting inflatable, sealed-off infectious disease tents on their grounds. Number 5. USA. As of April 14, 2020, 587,173 cases have been reported with 23,644 deaths and fifth highest recoveries of 36,948. USA has about 2.77 hospital beds per 1,000 people and 30,000 ventilators. USA confirmed the first case of COVID-19 on January 20, 2020, in a 35-year-old returnee from Wuhan, China, 5 days earlier. Walter Reed Army Institute of Research is currently working on COVID-19 vaccine which could take 12 to 18 months at its best. On March 25, U.S. Senate passed the $2 trillion package to solve economic crisis, including $500 billion for loans to larger businesses such as airlines, $350 billion for small business loans, $250 billion for individuals, $250 billion for unemployment insurance, $150 billion for state and municipal governments, and $130 billion for hospitals. Number 4. Iran. As of April 13, 2020, 73,303 cases have been reported with 4,585 deaths and fourth highest recoveries of 45,983. Iran has about 1.7 hospital beds per 1,000 people. Iran confirmed the first case of COVID-19 on the 19th of February 2020 in Qom, in a merchant who had traveled to China. The Ministry of Defense and Armed Forces Logistics created the first COVID-19 test kit on the 23rd of February. The Management and Planning Organization announced the government has allocated 5 trillion riyals to combat the virus. President Rouhani announced withdrawals of $1 billion from National Development Fund and 20% of the country's annual budget to be allocated to fight the virus. Number 3. Spain. As of April 14, 2020, 170,099 cases have been reported with 17,756 deaths and third highest recoveries of 64,727. Spain has about 2.97 hospital beds per 1,000 people. Spain confirmed the first case of COVID-19 on the 31st of January 2020, in La Gomera, Canary Islands, in a tourist from Germany. Spain declared national lockdown on the 15th of March. As of the 23rd of March 2020, there were 240,245 police officers and more than 2,500 military deployed across the country. The Czech Republic donated 10,000 protective medical suits and 90 respirators. The Spanish government has ordered 340,000 coronavirus test kits from Shenzhen BioEasy Biotechnology. Number 2. Germany. As of April 14, 2020, 130,072 cases have been reported with 3,194 deaths and second highest recoveries of 68,200. Germany has about 8 hospital beds per 1,000 people and 40,000 ventilators. Germany confirmed the first case of COVID-19 on the 27th of January 2020, near Munich, Bavaria. The German Bundestag approved, with a large majority, the stimulus package of €156 billion to fight against the virus. Robert Bosch GmbH announced it had developed a new COVID-19 test system, which could diagnose whether a patient was infected in less than 2.5 hours instead of days. Number 1. China. As of April 12, 2020, 82,249 cases have been reported with 3,341 deaths and highest recoveries of 77,738. China has about 4.34 hospital beds per 1,000 people. China confirmed first case of COVID-19 on the 1st of December 2019. The authorities announced the construction of a temporary hospital, Haoshan Hospital, which was completed in 10 days. In addition to newly constructed hospitals, China also converted 14 other facilities in Wuhan, such as convention centers and stadiums, into temporary hospitals. Japan donated 1 million face masks, Turkey dispatched medical equipment. Russia sent more than 13 tons of medical supplies. Malaysia announced a donation of 18 million medical gloves. Germany delivered various medical supplies including 10,000 hazmat suits, and the United States donated 17.8 tons of medical supplies to Wuhan, China.